10,000 tests. That brings the total number of tests we've conducted in Massachusetts to about 324,268 tests. Only 10% of the tests that were completed yesterday came back positive. That's the lowest percentage we've seen since the end of March, when the Commonwealth was testing about 5,000 people a day. We remain focused on continuing to expand our testing capacity and believe it's a good sign that as the testing numbers are getting bigger, the percent of positive cases is getting smaller. It's important to remember that the test results alone are not an accurate depiction of what's happening across the state with respect to COVID-19. The test results are completely dependent on who gets the test, and we've been targeting our tests to certain areas and facilities, long-term care, hotspots, and high-risk parts of the population to make sure that we have a good sense of what's going on in the places where we need the most information the most quickly. Every day we've had conversations with our colleagues in healthcare and in the hospital industry to monitor our healthcare capacity and our hospitalization rate. And as of Sunday, there were 3,539 patients, or about 5% of the cases in Massachusetts, that were hospitalized due to COVID-19, which is another drop from the day before. The total number of people hospitalized yesterday dropped by about 78 patients. We've seen a pretty steady downward trend on the number of people hospitalized for COVID-19 for just about a week. That's a really encouraging sign and a key piece of data that we watch closely with respect to almost all issues associated with how we're doing. We're still very much in the fight against the virus, but it's encouraging, I think, for everybody to see progress, given how much hard work and how much sacrifice has been invested in this. As we come through the other side of this and start to determine next steps for going forward, we need to see these numbers continue to fall. And that's based on guidance and advisories that we've gotten from this country and, frankly, from many others as well. One of our main priorities continues to remain tracking down more personal protective equipment and getting it out to healthcare facilities and other healthcare providers across the Commonwealth. As of yesterday, we've delivered almost 8.5 million pieces of PPE, including masks and gowns and gloves and ventilators. And we're getting this protective gear out to a variety of places, including hospitals, senior care facilities, long-term care facilities, and, of course, to our first responders.